I'm going to be talking about the end of the Medicare Cost Share program in Minnesota. And if you're one of the 400,000 Minnesotans on the Medicare Cost Share program, this is very important, so stay tuned. Okay, now we're going to talk about the end of the Medicare Cost Share program in Minnesota. And you likely thought that you're in Medicare, you're going to be right where you are for the rest of your life, and now all of a sudden they're going to end the program that you're on. So there's about 400,000 people on a cost share program in Minnesota. So it affects a large number of folks, and most are going to have no idea what to do going forward. So if you're new here, I'm Keith Armbrecht. I'm founder of Medicare on Video. I help people across the country figure out their Medicare choices. I have videos on just about everything Medicare, so certainly feel free to visit my website, medicareonvideo.com. Also, feel free to visit my review page on Facebook at movcomments.com and see what some other folks just like yourself are saying about how we help. And I'm happy to do it. It certainly makes me feel good to just give you the educational material that you need to make the right choice, and now you're going to have to make another choice. So understand this. So I'm going to use this healthcare choice guide, which is put out by Minnesota Board on Aging, and certainly thank you to the Minnesota Board on Aging. This is a terrific guide, certainly something you should have a copy of. If you don't have a copy of it, you can get a copy right on my website. Just go to medicareonvideo.com. Up in the left-hand corner, you'll see the Resource Center. It'll drop down and you will have guides and forms. So just click on guides and forms, and right here you can find it on the website. Click on it, it'll download onto your computer. You'll have it from now on. So it'll help you, and then you can go through it while we're talking about it right here. So I made it pretty easy to do that. So when you're at my website, also keep in mind that I'll have a button for Minnesota. So specifically to Minnesota, we're going to take some extra time to help the folks in Minnesota figure out these choices, because it's such a hard thing to figure out once you've already been in it and you thought everything was just going to remain the same. So this guide is 220 pages. We're not going to go through the whole 220 pages. I'm going to show you the important parts, and then again, you can follow along and use it as you feel the need. So let's first understand what we have now, Medicare Cost Plans. And you can see on the left, page 29 is where this is in the book. So if you want to follow along while we're going over it, you're welcome to do that. So Medicare Cost Plans are kind of a hybrid between Medicare, original Medicare with a supplement, and a Medicare Advantage plan. So it's kind of in the middle of those two, where you have a network of doctors, but it also gives you the ability to go out of the network. But it is run by a private insurance company, not part of original Medicare. So if you're on it, you probably have a pretty good idea of how it works and got a pretty good feel for it, so you understand it. So what's important is when this change comes along, you're going to get notice from your current Medicare cost plan. And it may be a pretty notice, it may be a good news notice, but it's really not so much good news. It is ending your current plan and putting you into another plan. And what it will likely say is, if you don't do anything, we're going to put you in a particular Medicare Advantage plan without any input from you. And that's absolutely not what we want to do. We want to make sure that we get the right one with the right network of doctors, the right drug formulary, and the one that's going to work best for you. So it's very important you understand this, you take the time to review your options and then make the choice, because this is so super important. You're going to be with it, again, hopefully the rest of your life. We thought it was going to be this way with the cost plans, but certainly once January 1, 2019 comes along, you're in it, and you're going to be in it for the year until the next open enrollment. So we got to make sure that we make the right choice. So we understand Medicare cost plans, and boom, it's ending January 2019. So we have to make a choice, and when we have to make a choice is also super important. We have to do it during open enrollment time. So you have to make your choice between October 15th and December 7th, and it will become effective on January 1st. So if you wait until December 8th, can't make a choice. December 10th, can't make a choice. It's already over and done. So you need to do your choosing between October 15th, December 7th, effective January 1st. Now, so much easier to get this done in the end of October, beginning of November. Let's not worry about it anymore. We'll figure it out. We'll make our choice. And even if you make a choice October 16th and then December 2nd, you want to change that choice, you can. So it's whatever the last choices you make is what counts. But let's do it, get it done, get it off our plate. And again, we'll help you get in the right place. That's exactly what I do, is I try to make it easy for everybody. So let's understand these options. So you have Medicare supplement insurance, Medicare Cost Plan, Medicare Advantage Plan. So that's kind of, it runs in that kind of flexibility fashion where Medicare supplement insurance does give you the most flexibility. It also has a higher premium. And it also does not include a drug plan. So you got to get a standalone prescription drug plan to go with a Medicare supplement plan. I would think that most people in Medicare cost plans right now are likely going to go to a Medicare Advantage plan. And we would just want to make sure we get the right Medicare Advantage plan, because they are all different. And they have different networks of doctors, different networks of hospitals. They have different drug formularies. So we need to make sure we get our doctors and our drugs covered, and that we are with the right carrier at the right cost. So that's certainly where we will come in to help and make sure that you understand it and that your choice is as simple as it can be. So that's what we'll try to accomplish. So understanding Medicare supplement policies in Minnesota. And here we go again. Minnesota is a little different than the rest of the country. The rest of the country, Medicare supplement plans are standardized. You have Plan G, Plan N, Plan F, and they're all identical. So it's much easier to choose between plans and carriers. In Minnesota, it's a little different. You have a base plan, you got to add riders to it, but we can make one come out to be pretty much a Plan G. So we'll help you figure that out as well. But just understand it's a little more complicated. And then here are your guaranteed issue rights in Minnesota. So when this cost share plan ends, it's going to give you a guaranteed issue right enrollment, meaning you can choose whatever you want and there aren't medical questions. So the insurance that you choose has to accept you. So it does give you rights so that nobody is harmed in this when they need to go choose another plan. So make sure you understand your guaranteed rights. And again, we can help you with that as well. Medicare Advantage plans. Very similar to Medicare cost plans, where they generally will have a network of doctors and hospitals, and they will also include Medicare drug coverage. So it includes that as part of that plan. So what we want to make sure is that we get in the right one. So you don't want to make the wrong choice, because then you're in it for an entire year and then you can change it the following year. But we want to get it right now. So we might as well take a little bit of time, get it figured out. And the different types of Medicare Advantage plans, you have what's called an HMO type Advantage plan, which is more restrictive. It has a generally smaller network of doctors, smaller network of hospitals. It may require things like referrals from a primary to go to a specialist, which is something that I don't know anybody that likes that. But HMO plans generally have low to no premium, so they can be very affordable on the premium side, sometimes with zero premium. Or you have a PPO type Advantage plan where it's a generally larger network of doctors, generally larger network of hospitals, generally does not need a referral to go from one doctor to a specialist, that kind of scenario. So a little more flexibility. And if I were choosing, I would absolutely be looking at a PPO. I would not be looking at an HMO unless it was absolutely necessary that I had to. But a PPO, and it's just finding the right one with the right network and the right drug formulary that's important to do. So different types of prescription drug plans. Again, if you had a Medicare supplement, you're going to have to purchase a standalone drug plan. And I don't know if you know anything about the standalone drug plans, but they're a little nutty. And I have a video specifically on that, and I think I describe it as a circus because it has quadrant 1 coverage, quadrant 2 coverage, then you go into the donut hole, then you enter catastrophic coverage. It really, to manage a standalone drug plan, it's kind of crazy. Medicare Advantage plans include drug plans generally as part of their plan. They can be a little similar to a standalone, but sometimes they work a little more smoothly. So again, it's finding the right one that's important. So that gives you kind of an overview on where you are and what your choices are going to be going forward. And again, what we don't want to do is let them make the choice for us. So at the very least, they may have the right choice, but let's verify that that's the right choice. And let's look at our options, make sure we get the best network, the best drug plan, and the best overall coverage at the lowest cost. And we're happy to help you do that. So just click right here on the Minnesota section and ask for your basic information, and we will get everything that you need to know in a very timely fashion. We'll get this off your plate as quick as possible. So I hope you found this helpful, and if there's anything that I can do for you, visit my site, give me a call. I'm happy to help, and I hope you have a fantastic day.